Thank you, Julie, so much. We are very excited that you're here, and I have the pleasure and privilege of getting to moderate today's series or webinar. And I am also honored to introduce our panelists today. We'll be talking or hearing presentations from Dr. Nanci Coppola, Cliff Baskerville, and Jennifer Todd. There's been a little bit of a last minute change because I know you might have been expecting Dr. Plastino, but due to an emergency, her coworker, Jennifer Todd, who's very capable of presenting as well, will be joining us. So I'd like to introduce you or tell you a little bit about our panelists. You are probably familiar with Dr. Nanci Coppola and have seen her on a few webinars. She is a senior program manager at Public Strategies. And immediately before joining Public Strategies, Dr. Coppola served as senior legislative and policy advisor at the U.S. Department of Health and Human Services, HHS, Office of the Assistant Secretary of Health, also known as OASH, and Office of Population Affairs, or OPA. And prior to joining OASH, Dr. Coppola worked on an international HIV prevention project with the Office of the U.S. Global AIDS Coordinator as the U.S. Global AIDS Coordinator at the U.S. Department of State. Before her federal service, Dr. Coppola served as CEO of Program REACH, which is when I met her. That is a nonprofit organization in the Bronx, New York, providing health education for youth development and sexual risk avoidance education programs in middle and high schools. We also have the privilege of today of hearing from Cliff Baskerville. A little unbeknownst thing I know about Cliff that is not listed in your bio, and if you'd like more information from these bios, it will be available when this webinar is posted to the Exchange. I want to highly recommend you contact the Exchange often for more resources and more information. But Cliff played cornerback for the UNC football team and then played professionally in the Canadian Football League. But also, Cliff currently serves as Vice President of the Southeast region of Choosing the Best Publishing, where he has worked with thousands of teachers and teams across the country through teacher trainings, school assemblies, peer retreats, and relationship trainings as well. And again, filling in for Dr. Plastino is Jennifer Todd, and Jennifer Todd is a registered nurse and an attorney. That is quite an impressive combination, Jennifer. And she has worked with positive youth development for over 20 years. Jennifer has been the program manager at UTT Teen Health for over 10 years and has provided oversight for 15 grants that focus on teen pregnancy prevention initiatives while promoting overall health and wellness. So today, when you finish listening to this very informative webinar, this is our hope that you will be able to understand how continuous quality improvement can, or CQI is what we'll be calling it sometimes, can help to improve implementation of recruitment and retention strategies. You will also be able to understand how to identify and analyze strengths and areas for improvement in recruitment and retention of youth participants, and identify additional CQI or continuous quality improvement tools. Without further ado, my pleasure to introduce to you Dr. Nanci Coppola.
Good afternoon, everyone. And Tracy, thank you for that introduction. As Tracy pointed out, the focus of today's webinar is on using continuous quality improvement, or CQI, to recruit and retain youth in SRAE programs. But before we speak specifically about how CQI can be used to improve your recruitment and retention efforts, I'd like to spend a few minutes reviewing the CQI process so that we're all on the same page. There is, as Tracy pointed out, a wealth of information on the Exchange, including a great deal of information related to continuous quality improvement. And the resources page at the end of this slide deck will also provide some links to additional information on CQI for your reference. I want to start by posing a question, and I'd like you to start to put your answers into the chat box. However, I don't want you to hit send until I give you the signal to do so. So I will invite you to briefly explain how you would describe CQI. And I'll give us just a minute to answer that question so you can start typing in. Please don't hit send until the minute is up and I give you the count of 3. So I'll be quiet so that those of you who need to concentrate as you think about giving us your responses. And we've got about 10 seconds left here. Okay, so on the count of 3, please hit send. 1, 2, 3. So I see the activity of informing future programming on success and failure of past implementation, continue monitoring, improved information for the population we serve, continuously trying to improve and implement things. These are great answers. And you're all pretty much right on here. So if we think about what continuous quality improvement is, it really is an internal evaluation approach targeted at strengthening core systems by identifying and analyzing strengths and problems, as some of you pointed out. So it is an intentional and well-planned approach that can transform an organization by evaluating and improving systems. It's really a reasoned approach for improving positive program outcomes, and it deploys a rapid cycle process to monitor internal strategies that are linked then to improved outcomes. And through a stepwise and deliberate evaluation of your internal strengths and challenges, these processes can be utilized to improve recruitment and retention efforts in your SRAE programs. Now, I want to point out that CQI is really distinct from program monitoring. While program monitoring can be viewed as a passive process that entails tracking performance measures and monitoring, CQI is really an active approach to finding solutions to problems that exist. It goes one step further than program monitoring because it determines what you are doing and what you will do if you don't meet your benchmarks. So we can see here on these little light bulbs at the bottom of your screen, CQI requires data. So it is data driven. It is ongoing and requires regular attention and regular meetings. And it is iterative. So you use what you learn to improve your processes. So CQI is really, as I said, a methodical approach. And we use it to identify a challenge and then dissect that challenge sufficiently so that we can understand the cause of the challenge and begin to develop and test solutions for overcoming the challenge that we face. So I'd like to look for a minute at this very simple example of a process that we see before us. The problem that we have framed is that the elevator is too slow, and we have all experienced this. You push that button and you want immediate gratification. You want those elevator doors to open. But I would suggest that we should reframe the problem and say that perhaps it's not just the elevator being too slow, but for us, the wait is annoying. So when we look to find a solution, there are 2 ways to approach this. In our solution space, we can think about how can we make the elevator faster. We can install a new lift, we can upgrade the motor, we can improve the algorithm so that when we push that button, there's a more immediate response. Or we can make the wait feel shorter, putting up mirrors, playing music, installing a hand sanitizer dispenser so that folks are distracted and are not annoyed by the elevator taking the same amount of time. I want to use the chat function again, if you will, and just, you don't have to wait for me here, just answer this question. How confident do you feel using CQI to improve program recruitment and retention? So we can get a pulse of who's here. I see a confident. So your choices here are very confident, confident, somewhat confident, or not confident. So I'm seeing a lot of somewhat and some very confidence. Okay, so we'll learn and grow together. And as we'll hear, great, some are feeling very confident. That's good to hear. So as we go through this series, this is our 4th series now, and we'll have this webinar, and then you'll have a tip sheet, a cluster call, and some workshops. And so the hope is that by the end of this, those of you who are feeling somewhat confident can move into at least that B category of feeling confident. And those of you who are Bs now can move up to becoming As. So as the name implies, CQI is continuous. Therefore, it's typically presented as a cycle. The Plan, Do, Study, Act cycle is a systematic process for gaining valuable learning and knowledge from the continual improvement of a product, process, or service. As the image here shows, you continue to repeat the steps until you have the strongest possible system in place to form the best model for effectively addressing the issue at hand. So after we have discovered that a problem exists, the first step is planning. And this step involves understanding the problem or the challenge, and then we set about developing strategies for improving. Now, I do want to point out here that some CQI models have an additional step, and in those models, planning and development are broken down into 2 steps. So you would see a 5-step cycle rather than the 4-step cycle that we are presenting here. Either way, after we plan and develop, the next step is implementing the strategies. And we do that so that in the 3rd step, we can test their effectiveness. And this is really our measurement piece, which drives everything else that we do. After we analyze and measure, then finally we act and we reflect so that we can identify additional areas for improvement. And that's just the beginning, because then we start the cycle all over again. And that iterative cycle is what's making this a continuous quality improvement plan. Now, there are a number of different Plan, Do, Study, Act worksheets templates that can help you with the process. And we see an example here of the Plan, Do, Study, Act worksheet, which provides an opportunity for you to track the steps taken in continuous quality improvement process. Now, Julie has just dropped for you the link for this worksheet in the chat box for your use at a later time. If you want to just save that link and hold on to it. For those of you who plan to join us for the Series 4 workshops on CQI, you will have an opportunity during those workshops to spend more time dissecting this worksheet and finding ways to apply it to your CQI process to improve your recruitment and retention efforts. And as we can see from the form, it really just gives us a way to memorialize the work that we're doing as we go through our CQI process. Now, a CQI process can be used to improve any aspect of your program. Program implementation, fidelity, youth engagement, or staff retention. However, the focus of today's webinar will be on using CQI to improve the recruitment and retention of youth in your SRAE program. So why focus on quality improvement for recruitment and retention issues? And really the answer is we do that because quality is malleable, it is measurable, and it matters. So I'll give you a second to just look at this, and always like to add just a little bit of humor in, but clearly we can see here that quality matters, because if we had purchased pens with a slogan that says excellence is in the details and detail were not spelled right, we would be really very upset, and it wouldn't really be a great marketing tool. In a similar way, if we had ordered slightly irregular coffee mugs that said quality matters, that too would not be a great marketing tool. So let's look at and dissect a little bit the measurable part of quality. And when our processes are measurable, it's really easy to find out where the problems exist and to be able to course correct as needed to overcome the challenges. So if retention is the issue, then we first need to determine what our current attendance rates are, and then set a goal for improving those rates. And those goals that we set should be specific, measurable, achievable, relevant, and time-bound. So in this example, where we're suffering from a recruitment issue, the problem is that although recruitment efforts have resulted in enrollment of sufficient numbers of youth to meet the benchmarks of our grant, the attendance is consistently falling below the anticipated rate of 80% of the youth per session. So our goal should be to increase the attendance. And if we're going to use SMART objectives to do that, a goal could be to increase attendance in youth at a specific site from 60% where it currently is to 70% of enrolled youth per session within 90 days. And then we would set another goal to further increase the attendance from 70 to 80% of the enrolled youth per session within 180 days. So in this example, we can see that our goals meet the SMART objectives. They are specific, they are measurable, they are achievable, they are relevant to our project, and they are time-bound. What does it mean when I say quality is malleable? Malleable simply means that it's capable of being altered or controlled. So we can change it and we can improve. So a CQI strategy then improves program quality. It works across different types of systems as well as challenging conditions, and it appears to be sustainable and cost effective. Now, there are many different tools for CQI. However, they all focus on identifying and analyzing strengths and problems and documenting our processes for implementing, testing, and then revising solutions. Now, some of the names of the tools that you may encounter when researching or hearing about CQI are data-driven decision-making, which really refers to any system that allows you to build a system of data-based learning to improve your processes. You may come across or may have heard of rapid cycle evaluation, and this is really just an umbrella term for processes that collect interim data in an iterative and formative way to track your progress and improve programs and outcomes along the way. The Plan, Do, Study, Act cycle, which we looked at just a short while ago, is a systematic process for gaining valuable learning and knowledge by following that cycle of developing plans to address the problem, implementing the plan, studying the results, and then modifying the plan. And finally, the LI squared, or Learn, Innovate, Improve, is a systematic technical assistance process for improving program quality, efficiency, and effectiveness that's been presented in several ACF-sponsored workshops, including some hosted by Mathematica. And again, you can find those on the exchange for additional information. I mention all of these tools here so that you understand that there are a wealth of tools that can be used to get to the same goal, which is really improving your recruitment and retention efforts. So before we conceptualize a project, it really is essential to understand the underlying problem in the community of interest, in this case, our SRAE programs, and to then explore what is causing it, what interventions could be used to solve it, and how long the intervention for solving the problem would need to last. So a great place to start the process of using CQI to address recruitment and retention issues is to begin to develop a process map. I'd like for us to take a look at what a process map might look like, and how would we approach our initial concern. So if we start with a process map, it really helps us to determine what is currently being done, thus highlighting the potential weaknesses in our process. And creating a process map provides for us a foundation for having a very frank discussion about the areas where we need to improve. Now, a really easy way to create a process map is to use those large Post-it notes that just go up on the wall and everyone starts writing. If you're more into having electronic tools, Microsoft Visio is another great resource for creating process maps that are easily shared. Depending on what your situation is, you'll need to determine the best tool for your organization. Regardless of how you choose to create the process map, the map will help you make sure that everyone that is a stakeholder here is on the same page. So let's just take a look at what we have here. If we're trying to address a problem that we're having with our recruitment, our initial outreach, we would assemble the recruitment team. We would develop a list of potential partners, and that could include schools, community-based organizations, faith-based organizations, and others. We would then detail the process that we are currently using for our initial contact, and then detail the process for scheduling follow-up with those contacts and looking at what our follow-up looks like. Are we determining who is interested? And then once we determine whether folks are interested or not, what are our next steps in setting up a meeting? Perhaps more importantly, to address the challenge is if we do not get a response of interest, if there is no interest expressed, how do we gather feedback to figure out what went wrong so that we can improve the next time? I'd like us to dissect the process map for a minute and understand that for each step along the way, the process map team needs to keep asking the same question. And that question is, what do we need to know? What do we need to know about how this step is completed so that we can figure out what's working and what isn't? Because knowing what happens along the way allows us to maintain a uniform process so that we can truly assess our strengths and weaknesses. And then this opens the door for understanding solutions to the challenges that we face. So here we've assembled our recruitment team, developing this list of potential partners. We have to ask ourselves a question. What do we need to know is, are we focusing on all of the potential partners? Or in this specific challenge, are we just focusing on one specific group? What do we need to know about the initial contact? You explain how your program will help your partners better serve you. And then scheduling a follow-up. What do we need to know? Have you considered other stakeholders, and are you reaching out at the right time? I see a question here, detail the process for the initial contact. So what that means is that your team should talk about how you initially reach out to a potential partner when you are trying to recruit a new school or organization where you would deliver programming or where you would partner to deliver your programming. Hopefully that answers the question. So once we have dissected the process map, we're ready to round out our assessment of the process map, and we need to ask ourselves some important questions. So the first question we're asking is, did we get a positive response to our outreach? Did that potential partner express interest? If yes, then we set up a meeting and we have to determine how we will approach that meeting. If no, then we gather feedback and we ask, why didn't it work? So we're constantly asking the questions why and how. And we're always wanting to know, what more do we need to know? Why didn't a specific approach work? How can we fix the issue we encountered? As we look at some of the specific tools which can help us to improve, I would like you to keep those why and how questions in mind. So how do we gather feedback if we didn't get a response? So I think that's a great question, but very often there needs to be a specific person on the team who is assigned to going back to the party and finding out why they were not interested. So it may be that you got a negative response saying thank you very much, but we don't want to participate, and then you need to figure out why they didn't. It may also be that you didn't get any response at all, and then you would take that step to reach out and see if you can follow up via another means of communication. If you had sent an email and asked for a response and you didn't get one, can you call? Can we try a different outreach? And I know, it is very difficult work and it takes a lot of time and effort, but it's really important in order to grow to find out what didn't work. Knowing what works is only half of the solution. We need to know what doesn't work as well. So we're going to look today at 3 specific continuous quality improvement tools that can assist you in improving your recruitment and retention efforts in your SRAE programs. We'll look at a problem tree analysis. We'll look at a 5 whys, 5 how approach, and we will look at a fishbone diagram. And so I see a question here. Can you give an example of what questions we would ask? And I'll give a few here, but we're also, in fact, I'm going to ask you to hold that question to the end because we are going to hear from the grantee panelists. And if we've not answered this question about examples of what questions we could ask, we'll come back to this at the end. So Tracy, if you would do me a favor and just capture Linda's name in this question so we don't lose it at the end, we'll make sure we ask it. There you go. Thanks, Tracy. So I want to start with looking at the problem tree analysis. And there are strategic ways to identify the focal problem and its causes. But one common way that many organizations define these issues is through a problem tree analysis. And a problem tree analysis is really an effective approach for understanding what we are doing. Simply put, it's a root cause analysis of the issue at hand. And we all know that the roots, although we don't see them because they're underground, the roots are the most critical part for the life of that tree. So when we think about the problem tree analysis, remember those roots underground are the most important thing we need to figure out. So we start though by identifying the problem and the need for developing a solution. And that problem is really seen as the trunk of the tree. But I want to point out that it's really important that doing this problem tree analysis needs to be a group activity that involves input from project team members, stakeholders, and beneficiaries. In this case, it would be your community partners, the youth that you serve, and their parents as well. Because all of those individuals, all of those stakeholders, in addition to your own staff, can contribute relevant knowledge regarding the issue at hand. Why do we use a team approach to identifying the problem? I am sure that probably every one of you on this call has seen this diagram of the elephant here before. Several blind folks encountering an elephant for the first time, and one person who's feeling the trunk says it's a snake. The person feeling the tusk thinks it's a spear. The ear is interpreted as a fan. The body is interpreted as a wall, and the tail is interpreted as a rope. So without a team approach, without all of those different stakeholders involved, we can't see the whole picture. We can't get to the root analysis, and therefore coming up with viable solutions is far more difficult. So in these discussions then, the focal problem is identified and agreed upon by all of the team members. And that item then, as I said before, is visualized as the trunk of the tree or our main problem. Through many rounds of discussion and dialogue, the team would then work to identify the causes of the main problem, and those are visualized as the roots of the tree, which I said are critical to finding a solution. Finally, the team would brainstorm on the possible consequences of the problem, as well as decisions about possible solutions. And those are visualized as the branches of the tree. And using a problem tree analysis will build a shared sense of purpose, action, and understanding. And when we have a shared purpose, finding solutions is far easier. Now, another approach to continuous quality improvement is the 5 whys approach. And using a 5 whys approach can help address a problem that keeps reoccurring. We think we fixed it and then it's back again. So if you're not getting the root cause, then you're merely working on treating the symptoms, and there's a chance that the problem will reoccur. A 5 whys approach helps us to identify the root cause of the problem. And if a permanent solution rather, is not determined and implemented, then we know we're apt to see that problem repeat itself. I want us to look at this example of 5 whys. And when we look at 5 whys, we're thinking about going down a ladder from the top to the bottom. We use this 5 whys approach. So what is our problem? Here in this example, we're at risk of not hitting the target number of youth to be served. So this, as opposed to our retention problem that we looked at earlier, is really a recruitment problem. And so we ask the question why at least 5 times to drill down and figure out what's going on. On our first ask of why did this occur, we find that the enrollment numbers are below what was anticipated at this point in the project year. We ask why again, why did this occur? Recruitment rates are falling short of projected number of youth to be served. Well, why did this occur? We have fewer sites than we originally anticipated. And why did that occur? 2 sites withdrew from programming due to change in leadership. And we asked the time, why did this occur? And we find that there's a lack of community awareness and appreciation of the work that our organization does. So we use this 5 whys approach to climb down that ladder, as I said, to drive down to the root cause of the problem. And now we're going to use a 5 hows approach to reversing the problem and the process and climbing up the ladder so that we can reach a solution. So here are our 5 hows. And as I said, we're going to start at the bottom. How do we do this? How do we start to fix the problem? Well, we generate an appreciation for the contributions that the organization makes to the well-being of the youth that we serve. How do we do that? We build a sense of community awareness for the organization. How do we do that? We spread the word about the organization, the programs we deliver, and our positive outcomes. We ask again, how do we do this? We develop a recruitment and retention plan that includes a community-wide marketing effort. And the 5th time we ask, how do we do this? We schedule focus groups with stakeholders to understand messaging that works for the community. So what is the solution? The solution is to schedule enough staff time and resources to promote our program and the work we do within the community. So the 5 whys and 5 hows technique really constitutes this questioning process that's designed to drill down into the details of the problem or a solution and then peel away the layers of symptoms. This technique was originally developed by Sakichi Toyoda, who is the founder of Toyota. And he stated that by repeating why 5 times, the nature of any problem as well as its solution will become clear. Now, I want us to remember that as we have these discussions internally with our staff and with our stakeholders, we need to be applying the concepts of formulating SMART objectives because our proposed solutions always need to be specific, measurable, achievable, relevant, and time-bound. So here our solution, schedule sufficient staff time and resources to promote our program and the work we do within the community. We would then need to determine how much we're going to devote in terms of staff time and resources, and we need to make it measurable, we need to make it achievable. What's our time frame for doing this, and how much do we want that work to improve our recruitment efforts? So the 5 whys then are used for drilling down, and the 5 hows are used to help us climb back up and develop the details of the solution to the problem. Both of these sets of questions are designed to bring clarity and refinement to a problem or a potential solution, getting to the root cause or the root solution. The final approach that we're going to look at today is a cause and effect fishbone diagram. So I want us to look at this example where the effect or the problem in this basketball example is missed free throws. So we need to ask ourselves sufficient questions. And in a way, we're going through the 5 whys and figuring out why we're missing the free throws. So here, the 5 potential reasons that we're missing the free throws is it could be something related to the environment on the bottom we see, or it could be related to the machine, the hoop and the backboard, on the top, we see that it could be the person, the shooter. It could be the material. Is it the ball? It could be the method. Are they not shooting properly? Then we continue to drill down and ask questions again. And I'm not going to go through the whole example, but if we were to do our 5 whys about the machine, hoop, and backboard, the backboard stability could be a problem. Well, why might that be a problem? Why might the machine be a problem? It could be rim alignment. It could be rim size. It could be rim height, or it could be rim play. Is the ball larger than the rim? And so we would continue to just ask and dissect and continue to find out, why did this occur? Why did it happen? And then we can begin to work on our solutions. So I'd like to discuss for a moment what the fishbone diagram looks like in action, because sometimes folks have a difficult time understanding the fishbone diagram. When you look at it, it can seem overwhelming, but it really isn't. If we assemble our team and our stakeholders the same way we do for creating that process map, we use a team-wide approach and agree on a problem statement. What was our effect? So our problem statement in the prior example was the missed free throws, right? We're losing basketball games all of a sudden. Well, we're missing more free throws than we used to. We move on then to brainstorming the major categories of the causes of the problem, as we did in our example. And we write those categories as branches off of that main arrow. We continue to brainstorm and log all of the possible causes of the problem using branches of the fishbone. We use the 5 whys to search for our root causes, writing sub-causes that branch off of those causes, and we continue to ask why and generate deeper levels of causes. I would recommend to you that if you do this on a large wall and you just have lots of Post-its that you can draw on and mark up, that you leave that on the wall for a few days, encouraging your team to continue adding to the diagram. And Nanci Blue has added a comment here, which is so true. One action triggers another with focused direction. And that's why we keep asking and asking the questions, Nanci. Thank you. So we want to obviously continue encouraging the team to think deeper on the causes, so then we can pull up more strongly on our solutions. And when the group finally runs out of ideas, then it's really important to focus on the places on that diagram where the ideas are few and we haven't really gotten to the root cause, and then develop a plan for building out those areas. I want to look at a recruitment example here, and it's not mapped out entirely, but we've started to do this. So here we see that we're trying to get into a specific school or a specific district, and we're unable to do that. So we begin to start asking those questions of why and get down to the root causes. And the two examples that we have here are, there could be a lack of trust and credibility and a lack of buy-in for the program. If we take the lack of buy-in and we drill down even further, we see that there could be conflicting priorities, just not enough time in the day to add our programs in. Or the district or school may feel that we don't meet the needs of their programming or their health curriculum. With the lack of trust or credibility, we might find that the district has had fallout from failed partnerships in the past and they're afraid. Or the superintendent doesn't know us because he's new to the district. So I'd like us to end this part of today's session with one additional 1, 2, 3 send activity. And so I'd like you to start entering into the chat box again without hitting the send button until I give us the signal to do so. What would be the first 2 steps that you would take to address this issue if this were the problem that your organization were facing, that you could not get into a specific school or district? What 2 steps would you take to begin to address this issue? Again, I'm going to give you just about a minute to type your answers in. I'll try and stay quiet for those of you who need to think. Okay, we have about 10 seconds left on our minute. So on the count of 3, you can hit send. 1, 2, 3. There we go. So we're saying find a champion who will advocate for us, find someone who knows them, reach out to community partners. I see networking with the superintendent, PTA meetings, finding a champion who will advocate for us, using the why and how approach, discuss it with the team, survey the why not for the schools as a possibility. Great, these are great answers. Thank you all for sharing. Reach out to community partners, learn about the current need of the school and see how we could partner. Find community gatekeepers to the school system. Individuals have been there longer than the superintendent. Great. Dissect our approach strategy for convincing the school, reaching out to existing contacts and getting in contact with decision makers. So those are all great approaches. Thank you all so much for sharing. So the last question, attending open houses, learning school curriculum standards, great. The last question that remains is to determine if all of the planning and all of the doing and all of the studying and all of the acting has really worked. So we're really asking the question, has our hard work paid off? In order to figure that out, we first have to understand what success looks like. Do we build buy-in? Are our strategies being implemented as intended? Are the process changes linked to any specific interim outcomes? And are we making progress towards our initial target? And if we can answer these questions in the affirmative, then we know that our planning is working. So now that we all have an idea of the CQI tools that can work to improve recruitment and retention strategies, I'd like to move on to having us hear from our guest grantees about how they have used continuous quality improvement in the field. So I am going to turn it over now to Cliff Baskerville from Choosing the Best Publishing. Cliff?
How you guys doing this afternoon? Hearing from Nanci. First, I'd like to just say that was an awesome presentation. Nanci, awesome job. I love listening to CQI models and different tools and things that we implement every day. Like Tracy noted, my name is Clifton Baskerville, and Nanci as well, but my name is Clifton Baskerville. I am the Vice President here at Choosing the Best Publishing. I've been working here since 2001, and since that time, we've worked with close to 5 million students across the country. Now, through that, we've also worked with tons and tons and many organizations through the country as well. One thing we found is that some of them are doing very well. Others, maybe not as much. And sometimes when we look at the ones that aren't doing as well, Nanci brought up something called problem framing and being able to move into the solution space. A lot of times you're going to find that some of those programs are not doing that effectively. So what we've decided and what we developed were 4 elements of recruiting and retention as it relates to the workshop here today. So with us at Choosing the Best, again, Nanci talked about a lot of us doing different things. Some of us doing products, some of us working through processes or services. We typically do all 3. So we have meetings pretty much every Monday to do CQI. With us, we've been around for a long time, and this is something that we do each and every day. We talk about recruiting and retention. With us, our customers are school districts and organizations such as yourselves, those are students, and we absolutely need for us to be successful to not only recruit new organizations and customers and students, but to also have them retain and staying a part of our program, similar to you guys. You guys are recruiting students all the time, and it's very paramount and important to you guys and the visions and things that you have to make sure that they retain and stay a part of your program. So with us, it starts with every Monday, we have a clear vision and expectation that we lay out. And when we talk about that, a lot of times it starts with our vision and expectations. And if they're not exactly right, it can be hard when we're going out to recruit for them to even understand and want to be a part of our program. So the first thing we have to do is we have to plan. And when we do our planning, we're developing at the same time, but we're talking about mission statements. Is our mission statement absolutely right? Do we have to tweak our mission statement, right? We're talking about recruitment strategies. We're talking about marketing and outreach. We're talking about cultural biases, depending upon where we're going or who we're trying to recruit into our program. We're talking about unintended consequences. Sometimes what looks good in one area may not be the best. Let's go back one, right? It may not be exactly what's right as far as another area. We're talking about state health and standard correlations. We're talking about state build and grant correlations. We're talking about how to get feedback, right? We're talking about our elevator speeches and fine tuning what our elevator speeches look like. We're also talking about video reproduction and medical updates. So all I have to say is that in our planning meetings and all the different things that we're doing as we're practicing and working with our clear vision and expectations, there's a lot that we do all the time. Nanci talked about having the chart up on the board. In our office, we actually have a wall that's just an erasable wall, and it's the full wall, and it is marked up every Monday to make sure that we can always stay and see what our implementations are, what our plan is going to be so we can execute it. Now that brings us to the do that you see there on the screen, right? The first thing was the plan. That brings us to the do. Because once we do, when we have our plan developed, it's just as important to make sure our implementation phase is going to be as effective as it looked on the board than when we were writing everything on the board. So now we're talking about the locations that we're going to. We're talking about the dosage and the amount of time that it's going to take, or is this even the right time to approach somebody or to start working and teaching? We're talking about the where, the who. We're talking about the follow-ups and parent involvement. Is this an email as far as recruiting strategy? Is this a phone call recruiting strategy? Is this going to superintendents and talking to school districts face to face? Is it using our advocates and our partnerships in the communities? We're evaluating all of that in our implementation phase to make sure that when we're implementing, it's going to be as effective as it was on the drawing board when we did our planning and our developing. And then again, we're now talking about our evaluation. Once we've recruited the students that we need to recruit, right? Now it's time to evaluate our recruiting efforts. It's time to evaluate our teaching inside of the schools or our delivery of services. And through that, now we're doing what? We're trying to get feedback, immediate feedback. We give students opportunities to give us feedback on a timely basis. We're talking about entry and exit surveys. We're talking about data evaluations to make sure that the expected outcome is actually taking place. We're talking about parent involvement, right? We're talking about student letters and focus groups to make sure that we are, again, impacting the students the way in which we feel that we can, and it's happening in real life. After we've done all of that, now it's time to refine and act. We've gone over the program over and over and over again, and we did a lot of refining in that phase. We did the implementation and we saw, okay, well, now we got to refine some in that phase as well. And then also we went to our evaluation piece, and clearly we got a lot of feedback, and now it's time for us to act and refine and make sure that, again, everything that we've intended to do is happening the way we want it to go. The second element, that's all under the first element, right? But the second element is pretty much your effort. Go to the next slide there, Nanci. The second one is now it's your effort. Now, it took a lot of effort to get here, right? But it's amazing how intuitive your customers and your students actually are. They can look at the product, or they can look at your presentation, or they can look at your organization, and they're going to form an opinion about, yeah, how much effort do I need to give you guys as it relates to my participation in this program and also staying. So you'll see there it says being prepared. Well, the first thing there is we're talking about your events. How timely are they? Were you able to provide the right content? Did everything work exactly the way, were the expectations that were met? And that takes effort to do that beforehand. That's not something that you can do on the run or do on the fly. Now, sometimes out of necessity, things like that may happen, right? But as you're going forward, you want to make sure that they understand the effort that it took for you to go ahead and put that presentation on. It also has to be relatable. And when I say relatable, right, and again, all of this takes effort and research and study. Now, my elevator speech, was it relatable enough to get people on board? Did I research it and prepare and find out what the needs were in that particular county, that particular district, that particular student's life? My delivery, my humor, my approach, it all has to be relatable, but this takes effort because it takes research and time to make sure. Now, remember, we're doing all of this because, yeah, we want to recruit people and we want them to be retained. I always believe that those that are already in my program, the recruiters, or my students that I've already recruited, they become my best recruiters as well, because again, they understood. And then again, the effort that it takes to make sure that your program is current, your stats, your medical updates, your videos, whatever you have in your program, just making sure that it's current enough to go through. I always laugh and I talk about one of the movies I loved growing up, which was Sixth Sense. And I remember showing my children Sixth Sense about a few years ago. And as much as I loved that movie, we couldn't get past the first 10 or 15 minutes because they were laughing and giggling and talking about the oldness and the quality. And I said, wow. But that happens in school districts and organizations all the time as well. So you want to make sure that doesn't happen to your program. If you go to the third element, you're going to find that after we've done the clear vision and expectations, after we've done our effort, then we have to make sure that our program is of quality. And when I say of quality, I always interpret that as value, right? Because the funny thing is that the students and the organizations or the districts will look at your program and they will start determining how much you're valuing either the student or the organization or district by what they're seeing in your program. So it has to be of quality. So now we're talking about how sound is your program. Now we're talking about your medical accuracy. Now we're talking about, again, your delivery and the content of your program and what you're bringing. Does it fit in what the district needs? The Georgia courses or the standard course of studies in whatever state you may be in, does it meet? Does it correlate with the trauma approach methods that the school districts are asking for? Are you now fulfilling the bill? For example, Aaron's Law, when you talk about sexual violence and consent, when you're talking about vaping and sexting, they want to make sure that you are doing the research to make sure that your program is sound to what they're looking for. Now, the students are looking for relevance as well, the school districts and the students. And when I talk about relevance, now we're talking about the impact that you're having on their lives. Is this something that they can actually go back and take away from it and say, you know what, this impacted and changed my life? Now, again, when you talk about recruitment and retention, we talk about effort, that takes a lot of effort to make sure that they view that program in that manner. I always say, I want the students to actually hear my heart and not just my words. There's a difference between just educating and giving statistics as it relates to inspiring teenagers to take your information and understand and see the benefits of making these healthy choices. And then is there an opportunity and a chance for these students to reflect and be able to apply the program or apply some of the character of some of the information that you've given to these students into their lives. If they can't reflect, if they can't see, if they can't apply, again, it's hard for them to go out and tell somebody else, yeah, we need you to be in this program with me, right? Or I want to come back here next year. So again, this again is so important when we're talking about recruiting and retaining. And then lastly, which if you've done all the other three, you would do this absolutely. You want to be fully engaged. You want to be present, right, in your program. And when I say fully engaged, if you're fully engaged, that's the first step to making sure that your students will be fully engaged. And when I say that, um, you want to be not only engaged, and we're going all the way through, but you're not going to only want to be engaged with you when you're presenting and teaching, but I'm also talking about your social media platform. There's a lot of new things that are happening right now. I always joke and said I had a pencil and a paper when I was growing up. I don't know if that dates me or talks about my age, but I was great. I loved it. I had my pencil, I had my book, and it was I could write it in and doodle on the sides, and that was me. In today's time period, things have changed a little bit, and there's so much more that our students are into that it takes more for them to be engaged. I always say that we don't want our students to ever sit still while we instill, right? We want active learning and allow them participate. So your program has to fit or check those boxes. And when we're talking about your program now, I'm talking about even in the community, right? In the discussions and the healthy choices that are happening that are in your community. I'm talking about the Twitter feeds, the Instagrams, the Facebooks, right? The Snapchats and all the different things and platforms that our students are on now, the TikToks, right? Let everybody know what you guys are doing in the community. And when you're doing that, you're fully engaged. When the students are seeing that I'm part of something big, I'm part of something special, it becomes so easy for them to start recruiting and therefore retaining their commitments to you and your program from year after year. Now, we did just talk about the elements, right, that's going to help you guys do very, very well as it relates to recruiting and retaining your students in the program. But there are also barriers to recruiting and retention as well. And I know I don't have that much time, but I want to just go through it real quickly. But I'm not going to ask you guys to raise your hands at all, okay? But if you've engaged in or heard of or heard these statements inside of your organization, there may be opportunities for growth and there may be some retention and barriers or retention barriers that are minimizing or not allowing for you to maximize your opportunities. The first thing that organizations do that are not doing well is they give up on creativity. And you start hearing statements like, I can't compete with other distractions. TV, music, media, lack of funding. Those are all statements that we hear from time to time, which is pointing the finger that, you know what, I'm giving up on creativity. When we talk about problem framing that Nanci talked about earlier, let's reframe it, right? What are the opportunities that I have to better my program, right? To be as creative as I can be. It's easier to just keep doing what we've been doing. Like we've been doing it, no one's saying anything about it, but you also haven't evaluated, you also haven't refined, but it's easier just to keep doing what we've been doing. It's just going to be okay. Well, you may be actually giving up on creativity, and that's why you might see your numbers dwindling. If you go to the second barrier, you're going to find that we set our own standard, right? We set our own standard, right? This is what we've been doing. We've set our own standard. Well, now I'm not going out there and making sure my program is medical. In fact, it's medically inaccurate, right? I'm still utilizing things from the past and still having unintended consequences because this worked way back then, and that story was great way back then. But we're in a new time now, right? And there's new requirements and there's progress that's been made. So again, you might have to change and become way more inclusive, for example, than things were in the past. We want to make sure that we are touching sexual violence and prevention and doing it in a proper way, right? And there is no victim shaming or victim blaming inside of your story, even if it's an unintended consequence, right? So we want to make sure that you vetted your stories correctly. So it's not just about your own standard, it's making sure that you are adept enough to make sure that this is working. You're also going to find that people should just appreciate what we do, right? That's another one, right? They should just appreciate what we do. No one else is doing it but me. Oh man, I've heard that so many times. I'm the only one here in town that's doing it. Well, when you have that attitude, right, it stifles your creativity, right? Because they should just appreciate me. How many people recognize and realize that many people don't get their roses right then and there, right? No, I want to, it's not going to happen right then and there. And it's not they should appreciate what I do. It's, you know what, I want to do everything I can to help and benefit those that are around me. And again, this topic is not my perceived job description. That doesn't work well as either. Let's go to this last one real quick. This last one, people just begin to accept barriers. It is just what it is. No pressure to provide effective and engaging materials. So again, I'm just going to do what I've always done. Teens are not excited about your program, but that's okay. They got to come anyway, right? If you're in a program that they got to come, but that doesn't help you recruit and retain. Teachers are not enthusiastic, but it fits, you know, as part of their requirements, they got to do it. Yeah, that's good. They do have to do it. I want to get the message out. But if I'm falling for that trap, then I'm probably not exercising and being as creative as I can be. Because remember, I don't just want to fulfill requirements. I want to inspire these teenagers or inspire my customers to come back over and over again. And even better than that, I want to impact and change that life. And that's what's happening with our programs. So as I go real quick, and what I'm going to do real fast is I'm going to share my screen really fast, and then we'll go ahead and move forward. But let me see if I can share my screen. I don't have it yet. There I go. But there's been situations that we've come across, okay? And when we've come across those situations, we found that there's been organizations that have been able to do well and organizations that haven't. One such organization, they came up actually before the pandemic, and you started hearing things like, well, there's nothing that we can do. You started hearing things like, well, you know, we're doing virtual learning now, so again, we're not in the class, we can't be effective. It started, again, problem framing in such a way that it was not conducive to helping them find a solution. So as you guys can understand, they lost customers, they lost clientele. They didn't retain the students that they had from last year, nor could they recruit new ones. Then there was another program said, you know what? This gives us an opportunity to rebrand our program. This gives us an opportunity to provide digital and online platform learning. This gives us an opportunity to still have activities in the program, but help the students feel like, you know what, even if I'm not in the class, I can still participate and be in the class. So for example, this organization, they had their planning, they had their development, and they came to us and they really pushed for some changes and differences, which was awesome, right? And so they said, you know, we want to talk about a crush, infatuation, and love. And I said, okay, well, we can do it. They said, well, how are we going to do it? I said, you know what, we're going to have an activity. We can do it online. It can be digital. The students that are virtual can actually still benefit. It can be great face-to-face. I said, you know what, and we're going to do it here real quick in this last minute. I said, you know what, let's talk about the characteristics between a crush, infatuation, and love. And I want you guys actually right now to help me do that. So if I talk about the characteristics of a crush, right? You're going to find that when I blew up this balloon, it blew up right away, right? And I'm going to flip to the next slide real quick. And while I'm doing this, I want you to see if you guys can unscramble the words that you guys see on the screen in the chat bar real quick, in the chat section. Go ahead and unscramble those words so I can see that you got them, right? But a crush, it kind of, when I blew up this balloon, it blew up right away, right? It was almost like it's just a sudden attraction. You're going to find that within all relationships, though, there's sometimes a problem. There's challenges and things that can actually happen. And you're going to find that, you know what, one thing led to another. And like a lot of crushes done, you know what, they're over quickly. But then, you know what, on Monday, I was in love with Tanya. On Wednesday, I was in love with Marcia. But then on Friday, I was in love with Sarah. You know why? Because a crush actually happens a lot. All right, so I'm looking actually in and I'm starting to see that there are some things here. And as I go through, you'll see, let me see if you guys got them right. Did everybody get it? You got a sudden attraction for a crush, over quickly, happens a lot. But you know what? There's another emotion. Now, this one's a little bit different. This isn't just a crush. This is infatuation. It's not just a sudden attraction. In fact, if I'm looking at this helium balloon, it's like intense feelings, right? I feel like I'm on cloud 9, right? You're also going to find that these feelings are so intense that I just feel like everything is just going to be perfect at all times. But then it starts to change somewhat. In fact, I start hearing things like, where you going? Where you been? How come you didn't like my picture? How come you didn't come visit me on my page? It just became possessive. Why are you hanging out with those friends? It just should be just simply me, right? And then you're going to find that if I'm starting to feel that kind of pressure, if I'm starting to feel that closing in on that relationship, you're going to find that you find that infatuation to be very, very temporary. All right, I'm looking at the chat room and I'm seeing that you guys are on it. I got to make these a little bit harder for you guys. But it was intense feelings, possessive, and temporary, all characteristics of infatuation. And then lastly, and we'll be done, but then there's another emotion. It's not just a crush, right? It's not just infatuation, but now we're talking about love. And love is not just a sudden attraction, but intense feelings, but you got things like intense caring. You're more committed to the well-being of the other person. And just like we talked about in all these other relationships, sometimes you're going to find that, guess what, change can happen. There's consequences in a relationship. There's obstacles, there's challenges and things that we have to overcome. Now, clearly, we're not talking about abuse or abusive relationships because we want you to flee and get help and run from that. But again, in some situations, when you're overcoming things, you're going to find that love actually grows over time. I see you very good over there. It actually grows over time. And then the question is, well, how do you know if you're in love? And the answer is that, you know what it does? It takes time. So again, I see you guys writing in the chat. Very awesome, very awesome. Good job, good job. But again, there's a difference between a crush, infatuation, and love. All right, well, very, very good. Awesome. I know I'm done. I'm probably like a minute or two over time. Nanci, please don't hurt me. Please don't hurt me. But here we go. Thank you very, very much, guys.
Thank you, Cliff. Now we're going to be hearing from another grantee, Jennifer Todd. Or I'm sorry, another presenter, Jennifer Todd, not a grantee.
Thank you, everyone. And again, thank you for having me in place of Dr. Plastino as she was called away in an emergency. So today I have the pleasure of talking to you about the best practices for using CQI in program design and implementation. And it starts with the framework that works for you and your community. At UT Teen Health, we utilize the Getting to Outcomes framework, and we've utilized that since 2010. GTO is a toolkit that uses a 10-step process to help communities plan, implement, and evaluate the impact of programs. The 10-step GTO framework ensures that the needs and resources are assessed on an ongoing basis so that the project continues to align with the changing needs. Using GTO, partners are oriented to a plan for sustainability from the onset of program development. We use a sustainable model where partnering organizations are trained, mentored, provided support, and then eventually trained as trainers to continue to train others in their organization. Additionally, we train organizations on the basics of fidelity to the program model and to conduct observations for monitoring to provide their own continuous quality improvement. And as Nanci mentioned, there are many frameworks to utilize when conducting CQI, including the Plan, Do, Study, Act. I would encourage you to find one that works best for you and your community and that your leadership will support. So we'll talk now about the best practices for using CQI in program design and implementation. And as I mentioned, the GTO 10-step framework already includes the Plan, Do, Study, Act model to ensure CQI. And so for a plan, we gather our information about the program by collecting and analyzing data and developing solutions. So at UT Teen Health, we work with our partners to understand the programmatic goals and partner goals. And so when we're working with schools, we meet with administrators, parents, teachers, and at that time, we review curriculum. We work with the partner to identify adaptations that are acceptable to them and then submit those to the developer and funder for approval. Once we have the curriculum in place and the adaptations approved, we then present that curriculum, the goals, and highlight the identified positives of the curriculum and potential barriers to the School Health Advisory Council, which includes parents, it includes administrators, teachers, sometimes students, and some school board members. Once they've reviewed it, they make that recommendation and we move forward to the school board for final approval. Now for Do, we communicate the strategies and then we test them. And so this is where we work with our partners. We provide that CQI and letting them know how their facilitators are doing with implementation. And even prior to implementation, we have our facilitators or teachers complete a professional development survey to identify any gaps, and we offer online e-learning modules for them. UT Teen Health then conducts observations of each facilitator to provide immediate feedback and lessons learned, and then communicate that feedback and lessons learned with our main contact or partner and report whether they're meeting their intended goal. We also ask our facilitators to identify if they have additional needs, such as markers, newsprint, additional workbooks or stickers, and provide that for them. Moving on to study, we look at the goals, performance measures in real time and observations. So we assess performance measures and implementation as it's occurring, assess our partners' SMART goals, review observation forms to identify areas for improvement. And at UT Teen Health, we utilize IDEAS and REDCap, and both are online databases to review the performance measures, including observations in real time to identify any programmatic adjustments. So for example, we noticed that a facilitator's fidelity for lesson 1 was not either entered or met. And so we called that facilitator and found out that they had had a fire drill. And they had decided that they just weren't going to complete lesson 1. So instead of, we talked with them about the option of finishing lesson 1 the next day before they started lesson 2. And they went ahead and agreed to that. But had we not reviewed our data in real time and taken that action, we wouldn't have been able to know, number one, that they hadn't completed lesson 1 in its entirety and not have come up with a possible solution. And so ACT, this really means to adopt the solution or start over. And I do want to encourage that you communicate. Review the identified areas for improvement and meet with your partner to communicate those findings so that you can adopt that solution, or you can go start over from the beginning. We work with both facilitators and administrators to review those areas for improvement, and we also let them know where they are in reaching their goals. Twice a year, we provide a performance measure summary that includes their goal, the actual number of youth they reached, their retention, and their facilitator observation and fidelity score. And this helps administrators see the data and know that they've either found a solution and their program is working, or we need to go back to the drawing board and either find a new program or maybe find facilitators that feel more comfortable teaching the program. So CQI can also be used to identify areas for improvement for recruitment and retention. And there are several key opportunities to identify issues with attendance, which can inform different areas of program implementation and delivery. One of the key opportunities is to do a check-in when conducting an observation. At this time, you can actually speak with the facilitator to assess implementation thus far. And so for curriculums that have many lessons, you can observe about a third way through. And this will give you feedback on 1, attendance to date, and 2, the facilitator can share if they see any concerns with the content or participation levels. You can also produce missing data reports for attendance, which can assess attendance in real time. And this report shows the attendance for each lesson across implementation cohorts. You can also see patterns in attendance records indicating low attendance for certain lessons, or maybe it's facilitators are not entering data. And so this is an area to investigate further and improve the recruitment and retention for future implementation cycles. Another key opportunity is to hold those partner meetings at the end of each semester or at any time that makes sense for your partners. And this is where you can discuss the average attendance for each curriculum being implemented. And this allows for both the partner to assess attendance as a measure of being a good fit for their target population. One of the major challenges can be the lack of CQI tools to assess implementation measures like attendance and fidelity. Assessing recruitment and retention across several partners with many cohorts is also time-consuming and cumbersome if you don't have the right staff or right tools. And very often organizations don't have staff who are proficient in producing these automated reports. There's a significant barrier to recruiting and retaining youth, because if there's not an efficient way to assess attendance levels in real time, it's hard to make those real-time adjustments to the program delivery. Another major challenge is using CQI for recruiting and retaining youth, is that facilitators don't enter their electronic attendance records in real time, or they may not enter their data at all, as mentioned in our previous example. And at times, facilitators have reported that they just don't have sufficient time to complete attendance logs every day. But that really is the only way to assess our recruitment and retention through the reports from the data, from the attendance data. So if a class had high attendance or even perfect attendance, but the facilitator didn't enter the data online, there's really no way to capture that information. We've also heard from facilitators that sometimes to increase retention, they needed to provide incentives such as snacks, either a dress down day or a homework grade. And some facilitators have also offered to give students a celebration day if they meet 85% retention. And what that does is it now holds the entire class accountable, and they're the ones that are texting each other or encouraging them to come to the program. So lastly, it's important to start your CQI process from the beginning, and it helps to have strong leadership supporting the process at the start. At U Teaching Health, we have an evaluator who's responsible for overall CQI process, and that person has a PhD in public health, a biostatistician that we contract out to, and that biostatistician helps identify the fields to develop applications to help drive our reports in real time. And of course, our health educators to communicate the areas for improvement to our facilitators and to our partners. And each work very closely together, and I'll go through each one a little bit more specifically. So our evaluator is responsible for the overall CQI process, and this person will have a plan in place to assess attendance, fidelity, and observations. The plan involves working with the biostatistician and health educators to identify those areas for improvement, what training and technical assistance is required to make those improvements. And then the evaluator uses all those data points across all implementation cycles to identify potential patterns that need to be addressed across certain partners or even certain lessons. Our biostatistician works with our evaluator to identify which fields in those attendance, fidelity, and observation databases should be used to create our CQI reports. These automated reports include the missing data, fidelity data, identifying facilitators who report, no, I did not complete the activity, and also identifying facilitators who did not enter any attendance or fidelity And this provides overall observation scores for all our observations. This really helps us drive what facilitators or partners we need to continue to email, call, text, and send those that communication to. And lastly, as our health educator works with both the evaluator using the CQI reports produced by the biostatistician to identify those areas for improvement. Our health educator is responsible for identifying the appropriate training and technical assistance to address those CQI concerns, and then work with the facilitator and partner to ensure that they're addressing each of those concerns and that they have in fact received the training and technical assistance. I want to remind you that it truly takes an entire team to ensure CQI, and CQI is critical to that continued growth and improvement of your programs. And so now I will turn it over. If anybody has any questions, we will go ahead and take
Thank you,
questions.
Jennifer. Yes, thank you, Jennifer. And I just wanted to clarify, as two grantees, Cliff and Jennifer, thank you so much for just sharing the practical application of CQI. Now, I did have a couple questions in the chat that I wanted to address very quickly because we're running out of time. But I believe that Nancy Blue was asking Cliff, I hope you're still on here, Cliff, if is evaluation the most important part of the vision for the 4 elements under recruitment and retention? Would you say evaluation is of most importance?
I don't know if it would be, all of them are important to me. Like every single aspect of it from the beginning to the end are just value, they're just equal value and importance. So I would absolutely, definitely do the evaluation and spend as much research and time making sure you fine tune it and get it right. Because it is, without it, it's just hard to progress.
Right, and it just gives you objective perspective because it's not founded on what you think, it's founded on the facts, right? Also, Linda Doring asked in the chat to Nancy, what is meant by detail the process for initial contact when you were talking about the process map?
So I think detailing the process, and I think Jennifer really went through and did a great job of talking about the process that you need to do. You need to, I guess the best way to explain it, Linda, is to say that when you're thinking about what you have done, you need to write down everything, the obvious and the incredibly obvious. Map what you have done as if someone knows nothing about your program and how it works, but they're going to need to be able to recreate it tomorrow. And when you do that, then you can really see if you're skipping any steps and pieces are missing. So you really want to have those details in order to dig down and find out what's missing so that you can come up with the solutions.
Right, and then Linda had also asked, can you give examples of questions to be asked? But I think Cliff's presentation really covered that when he's talking about the ask why. It just reminded me of a toddler, why? But it's so smart to do that. And speaking of smart, last but not least question I think I have over here in the chat that I need to ask is, when you say CQI evaluators and health educators pro SRAE, is this health education a staff member? Would this be the same as an education director? And I guess the questions, you guys can see that in the chat. Not sure I understand 100%, Linda, but are you saying, are they pro SRAE? If they're working under the SRAE grant, I would assume they understand SRAE. Would you like to answer that, Nancy?
I don't mind answering it.
Okay, Jennifer.
So in our program, our evaluator and all of our programmatic staff are SRAE certified. We also ensure that it's program staff. So if they are reviewing a curriculum and we're going through CQI, we really do try to incorporate our entire team in either the process of getting trained in that curriculum or meeting with trained staff in that curriculum so that there is a holistic approach to what performance measures we're going to be looking at.
and objective perspective. Good job. All right, well, for the sake of time, I think we have 3 minutes left and I need to address a few other things. So on the next slide, Nancy, I wanted to point you all to some more resources. Youth Program Quality Assessment, Youth Program Quality Monitoring Tool, Learning About Quality, and the PDSA worksheet. Also, PDSA stands for Plan, Do, Study, Act. Okay, there are references, and you're going to receive a copy of this on the Exchange just in a week or so. That'll be published, and you can, click on the references, and also look for continued learning opportunities on the Exchange. The resources on, oh, I'm sorry, I thought you were going on to the continued. Go ahead and go to continued learning. Watch for the release of the tip sheet that will follow after this webinar. And then on the Exchange, don't forget there's resources like the tip sheets and research reports. There's a comment wall for us to be able to chat back and forth and share ideas and best practices. There are events calendars that you can check and training opportunities that are coming up more for you. And don't forget that you can ask for technical assistance. There's complimentary technical assistance from providers with decades of experience, and all you have to do is ask your program, or I'm sorry, your federal project officer, and they will submit a technical assistance request on your behalf. So without further ado, let me hand it back to Julie Marchbanks, and our contacts will be also listed on this presentation when it is posted to the Exchange.
Thank you, Tracy, and thank you all for joining today's webinar. We appreciate your time and attention. We do encourage you to complete the short post-webinar evaluation survey that will appear in a separate window when you exit today's webinar. This will conclude our webinar. Have a great day.